Hey guys, so in today's video, I thought I would do a video that is medical assistant related because I feel like a lot of my videos lately have been related to weight loss surgery. And so in this video, I wanted to talk about a few things that you can expect if you are a medical assistant or an LPN, honestly, working in an urgent care setting. I am going to be speaking from the experience of a medical assistant working in urgent care, but the reason why I say or an LPN is because at the clinic that I work at, the medical assistants and the LPNs can do exactly the same job responsibilities and tasks. We have zero difference in our job duties. The only difference between an LPN and a medical assistant at the clinic I work at is the amount of pay that they get per hour. So I work full-time as an urgent care medical assistant. In a rural community clinic setting. We are a critical access hospital, and we have a main clinic as well as I think three outlying clinics. And I have worked at all but one of the outlying clinics, and I mainly work in our main hospital clinic. So one thing that I will say that I actually truly enjoy about working in the urgent care setting is you never know what is going to walk in the door. So like the days that I have, you don't know if it's going to be super busy or not that busy at all. I try to avoid the Q word or the S word, which is slow, because I've had people say that and then they're like, "Oh, it's so Q in here," or "Oh, it's so S today." And I'm like, now that you said that, now all of the patients are going to come walking in, which I don't have a problem with that. Like, I love interacting with patients. And ever since I had weight loss surgery, like, I actually enjoy being up on my feet and not having to sit at a desk all day. So like, it's not like you have scheduled appointments. Our urgent care that I work at does not do scheduled appointments unless it is for a nurse visit, which is an allergy injection or a suture removal, or sometimes we have like other injections like vitamin B12 or antibiotic injections. Like, the providers at the clinic might order like Rocephin. So the patient can come in like every day for a week and get a Rocephin injection if they have some sort of infection or something like that going on. We've had it happen a few times. There are also patients who come in for wound care on the weekends, which they can actually do as a nurse visit as long as you have been trained on how to provide wound care for that patient. So there's that. Like, I truly enjoy not knowing what's going to walk in the door. I don't mind family medicine. I don't mind like getting into the routine of doing annuals and like physicals and doing DOT stuff or CDLs, OC Health, things like that. I don't mind that at all. I used to do that before I switched to working full-time in the sleep center, before I switched back to working full-time in the urgent care. So I like not knowing exactly what's going to happen from one day to the next. Like I said, sometimes it does get really hectic because there have been days where we have seen over 30 patients in the urgent care. And then there are days where we see like 6 or 7, and there's really not a whole lot to do. So during the time when it is slow, I find other things to do like organization, printing out copies of things, stocking exam rooms. At the clinic that I work at, we have 13 exam rooms. And so it's good to take the time to like help people out, make sure that all of the sharps containers are not expired, because like we do have sharps containers that expire. They expire every 90 days. So I like to check and make sure that everything is where it should be. I will organize things. I will restock our injection drawers because we have a couple of drawers where we have different size syringes and needles and things like that for injections. Another thing that I can say you should expect working in urgent care is the ability to learn new skills. So I have learned how to cast. I have learned how to do soft splinting and hard splinting. I have learned how to assist a provider with giving joint injections. that doesn't normally happen in the urgent care setting. I learned that when I was working in family medicine, but there are a couple of our providers who do urgent care and family medicine. And so sometimes they will see like their family medicine patients on an urgent care day, which I don't understand why people do that. Like, if you're supposed to be doing urgent care, you should be leaving your family medicine patients and appointments to your days where you're working in family medicine. But yeah, another thing I will say is you are going to see a lot of people who really should be making appointments with their primary care doctors. We get a lot of people who walk in who literally just need like medication refilled or something like that. Like, I think in the last week I've had 3 or 4 patients come in, and like literally what they need is they need to see their primary care doctor, but they can't get an appointment with them, and they literally need a medication refill. Some of our providers will send in refills for them just to get them through until they're able to get to an appointment. Some of our providers will not send in any refills, just because they feel like you should be able to call your provider's office and let them know, hey, I'm going to run out of my medication before I am able to get in for an appointment because your schedule is full. And most of the providers at the clinic that I work at are very good about sending in at least enough to get them by until they're able to make it to that appointment. I will say there are also a lot of people who come in seeking pain medication. There are a lot of people who come in on particular days when they notice that it's a provider who tends to send in pain medications. And just be mindful of the fact that you can't judge a person. Like, you shouldn't be judging a person for asking for pain medication because they might actually be in pain. But there was a situation where there was a patient who had gotten over, it was like 75 pain pills prescribed to them in a matter of 10 days. And they definitely should not have needed to go through that many in that short amount of time. So, just be very mindful of the fact that there are people out there who are going to be drug seeking, but don't let that like deter you from trying to talk to the person and find out exactly what's going on with them, because they might actually be in a lot of pain. They might have had an injury or something that causes them severe pain. And I have been guilty of judging someone or like assuming that somebody didn't need some sort of pain control. And I feel awful about it. And I am constantly working on bettering myself and bettering my attitude towards certain people. I would also say, like, something else you can expect working in the urgent care setting is, at least at the clinic that I work at, there are people who come in and it's like they're coming to some sort of fast food drive-through and they know exactly what they want. They want you to, or they want the provider, not the medical assistant or nurse. They want a specific medication and they want the provider to prescribe that specific medication. And if the provider refuses to give them exactly what they want, they tend to get an attitude. So just be mindful of the fact that things can escalate very quickly, and it is best to go into things with a positive outlook and be calm. If something escalates like that, be calm. If I would always keep a way for you to escape the room, even though you have to shut the door for privacy purposes. I always know exactly how I can get out of the room very, very quickly. I tend to put the computer screen in between myself and the patient just because, like, I need to make sure that if shit hits the fan, I have a way to escape the room and get out without potentially being injured, or at least give myself a little bit of a head start before I get injured. And it's kind of sad that you have to think that way, but people do get mad, especially if it's someone who is coming in who is drug seeking. I've had these experiences with patients who are drug seeking, and they tend to get very mad if the provider denies their request for a specific medication. So those are the things that I would say you can expect. I am going to go inside because it is almost 7:30. But if you guys have any other questions about working in urgent care or working as a medical assistant in general, obviously, like I said, I do have family medicine, internal medicine, and a bunch of other like specialty medicine type related experience, so I can share my experience with you guys and share my thoughts and feelings about certain things. So with that being said, that is all I have for today. I hope you guys are having a wonderful day, and I will talk to you guys next time.